We are now live.
Good afternoon and welcome to the Pillar Four Committee. We are grateful to be here today for our meeting. And I just want to make note that today's meeting is focused around improved education for students with disabilities. My name is Hope McGuire. I am a supervisor of community schools in MCPS, and I am the chair. And I will pass it to my colleagues so that they can introduce themselves, and then we will get into other parts of our meeting. Ellie?
Hi, everyone. I am the, I guess it's titled Vice Chair for the Pillar Four Advisory Group, and I run the Maryland Up School Time Network. I also serve as the backbone for the Maryland Coalition for Community Schools, and I will pass it to Shalita.
Good afternoon. My name is Shalita Jones. I am a shared accountability specialist for Montgomery County Public Schools and also a speech language pathologist. And I will pass it to Dr. Grant.
Good afternoon. I am Jessica Grant, principal at James Ryder Randall Elementary School. And I'm excited to be here today. I'm having some issues with my camera, so please forgive me in that aspect. And then I would like to pass it off to Joseph.
Hey everyone, I'm Joseph Mako. I am a board member with the Accountability and Implementation Board.
Thank you. At this
Hope.
time, we will go into AIB updates.
Thank you, Chair Hope. So we want to thank everyone for coming today and for tuning in if you're watching on our YouTube. The AIB updates, most importantly, in regard to Pillar 4, is the Neighborhood Indicators of Poverty report has been submitted, and it is now available for the public or any of those interested on the AIB website. And today we have a special presentation from our partners at MSDE around the update for the special education work group. And so to be respectful of their time because they patiently waited for our committee today, we will turn it over to them if that's okay with you, Chair Hope.
Yes, and I just asked for them to introduce themselves and then go straight into what they have. And welcome back. We appreciate you coming back for an update.
Absolutely. Happy to be here. So I'm Liz Zogby. I co-chaired the Blueprint Special Education Work Group. I'm from the Maryland Down Syndrome Advocacy Coalition. And as of yesterday, I am spending some time for the next few months as a consultant at MSDE to help with the implementation of the work group recommendations.
And hello, everybody. I am Carmen Brown. I'm a director here within the Division of Special Education, and I staffed the Blueprint Special Education Work Group from the division. And also I am in the interim capacity with one other director as we transition our assistant state superintendent. And then Amy, did you want me to share the PowerPoint or will you?
You should be able to share, but if not, let me know.
And while you're doing that, Carmen, I will say I always forget to put my other hat on, which is I am a parent and I have a now 15-year-old with Down syndrome named Hope. So, so we are going to start kind of quickly going over the basics because we've done this presentation sort of on the basics of what the work group was for you all, but we'll just kind of skate through that, but so that if other people are watching, they kind of know what we're talking about. So do you want to go to the next slide there, Carmen? So you'll recall that the Blueprint Special Education Work Group was created.
It's not letting me switch the slides. Got it.
So one more. The work group was convened by MSDE, charged by the AIB with making recommendations on instruction services and funding for students with disabilities. We had this really great, diverse membership of about 50 folks from across the state. I've been describing it lately as like the biggest IEP team you've ever seen, right? People from all different kinds of perspectives coming to the table to develop an evidence-based plan. So that's what we did. We had 16 meetings over the course of about a year and a half, and you can go and watch all the live streams and see all the materials that we looked at over the course of that time. Next slide. This is just, you've seen this before, but this is the arc of topics, the things that we covered over that time. So each meeting, we would look at some data, we would look at some research, we would talk about how things were going in Maryland. We would split up into small groups and then dig into some discussion questions around each one of these topics. Have folks give written feedback as well, and then develop recommendation that we would bring back to the next meeting. A couple just important points here. We started every meeting, every topic thinking about data. So it was very grounded in that. One of the things that we talked about over time, and that I've been thinking a lot about lately, is that the charge for the blueprint is to close achievement gaps. And in order to do that, we have to accelerate the progress of students with disabilities at a faster rate than we are improving things for all students. And, there's a lot of intentionality around strategy and practice in order to make that happen. So that was, I think, part of what we were thinking about as we were developing this pretty bold plan. So we then developed these recommendations. Again, you can go on the website, you can read them all. There's 27 of them altogether. But I think the kind of key here is we had, even amongst this very diverse group of folks that we had pulled together, broad agreement on what the problems were and a lot of agreement on almost every topic around what the solutions were. And that really led us to feel that we were on the right track, and that it wasn't so much that we didn't know what to do, it's that there were things that had been standing in our way. And so within the development of plans, we have been very intentional about thinking about those barriers to progress, that students are held to low expectations rather than high expectations, that the siloing of general and special education really prevents a lot of progress from happening, and that the tension that exists between our state agencies' responsibility and authority and local control in our districts is a challenging spot, and that part of the solution to that is making sure that what's coming out of our state agency is very supportive, that it's things that will help districts do better by students with disabilities. So those are the recommendations. And from those recommendations, we then had a conversation about, okay, so looking across all of those recommendations, what are the priorities? And so these are the priorities that we came up with. The first is this very foundational idea that students, the purpose of an IEP is for students with disabilities to achieve grade level standards. That is the expectation in the law. And so we have to ensure that IEPs are written in such a way and services are calculated in such a way that students can achieve that. Secondly is the use of evidence-based practices. So in order to enable students to reach those grade level standards, we should be implementing evidence-based practices in our classrooms. And that if we do those two things, we are going to get after some of the root causes of things like significant disproportionality and the over-reliance that we see in Maryland schools on more restrictive placements for students with disabilities who have less access to their non-disabled peers, the general education curriculum, and teachers, content expert teachers, the general education teachers, and those instructional experts, they're special educators. And then the third priority was around the supply and retention of teachers and developing teacher capacity. A lot of discussion and emphasis in the work group, not just on pipeline, but also on retention strategies, thinking about making schools places where teachers want to be because they have sustainable workloads and staffing models that work for teachers. Fourth foundational priority is around addressing disproportionality, significant disproportionality in the identification of students with disabilities of certain racial groups for within different eligibility categories, as well as for exclusionary discipline and in more segregated placements. The fifth is around an independent study of special education funding, and we're going to talk about that in a little bit. And then the final foundational priority is around building family and school partnerships. And the key here is around the idea that can't start at the IEP table. It has to start in schools, in school communities, so that when a student is then identified as having a disability, there's really a strong foundation of trust that already exists. And then two additional near-term priorities. One is around the least restrictive environment, and this final priority is around the Maryland Online IEP tool, which is the way that we build IEPs in our state, or most places in our state. So we have this list of some places where we have made some significant progress, and then some next steps. And I know that we also are going to talk, we'll talk a little bit at the end about some of the intersection with Pillar 2 in particular. I think there was some interest in talking about that. I want to stop to say one thing here, which is just that, this plan defines a vision for what service for students with disabilities should look like and can look like. It came about with a very different background context. And I think it doesn't make any sense to ignore the context that we're in right now. But it's also important to say that much of this vision can be implemented within the existing processes that we have in schools. It's about shifting orientations. It's about emphasis in our professional learning, in the kinds of guidance documents that we're creating. It's not new work, I guess. It's orientations that can be woven into the existing work, and so much of it is achievable, and the folks at MSDE and across the state have begun to do just that. So we can look at, we're going to look at each one of these things in sequence. And I think Carmen is going to talk about some of the things that MSDE has been doing, and then I'll just chime in to share a few thoughts as we go.
So first, we're going to start with the standard to close or narrow the academic performance gaps. So what MSDE has been able to do over the course of the year, pretty much, is we've published the standard to close or narrow the gap. And it sets the standard that IEPs should be written, must be written with the full expectation of helping close significant achievement gaps. Special ed directors and compliance managers were trained on the standards in the spring of 2025. And the Division of Special Education team has been delivering trainings on narrowing the gap to IEP chairs and special educators, those in the classroom across Maryland over the summer and fall. The training's primary focus has been on writing narrowing the gap goals, as this has been the area this division receives the most questions about. So additional areas of training have been in making meaningful service considerations. For instance, things like ensuring that the same services are not issued year after year when a student's progress has really stagnated. And we're also training folks to put standards aligned and narrowing the gap goals into a logical progression. So beginning in 2026, we will monitor these goals and give technical assistance to the local education agencies who require that support. So really based on the monitoring, we will provide very targeted technical assistance.
And I'm just going to chime in to say that, this standard was the first recommendation, came out of the first recommendation, and it's really foundational to all the work that is to follow, because it just sets the bar for what our expectations for students with disabilities should be. And so much will flow from this recommendation. In addition to writing goals, it's also about writing reasonably calculating services, and that those reasonably calculated services should be based to the fullest extent possible on evidence-based practices. And so as more trainings are rolled out around evidence-based practices for specially designed instruction, we'll see more opportunities for folks to understand how to embed those into IEPs, so that, just as an example, when the reading intervention, the research says, the evidence says it has to be delivered in, 4 times a week for 30 minutes in a group no more than 5. That's the way that it needs to go into the IEP, right? That is the evidence. And we can then expect to see progress. And if we don't see the rate of progress that we're looking for, we know how to dial it up in order to then try to achieve that in the next cycle. So this is really a very important part of what we needed to start with.
And so next, we just wanted to give you an update on the 2 studies that we're required to initiate. The first one is the Independent Special Education Funding Study. So this was submitted as an expedited procurement to the Board of Public Works on August 12th. It was approved on September 24th. Whoops, sorry. We met with the AIB to finalize this request for proposal and the content within it on October 6th. The final draft was approved on the 7th. It was released on the 8th. We had pre-proposal conferences with potential vendors on the 15th, and the RFP will close in a little more than a week. So we have a review committee already established that will review those bids as they come in, and we will expedite that process as well.
I'm just going to chime in to say 2 things. One is, and just so you can recall, that contract has to be awarded according to the law by January 1st of next year, and then the report needs to be completed by December 1st. So the idea will be, it's a pretty quick turnaround for the kind of study that we're talking about. And then just to touch on what the scope of that study is, it's to look at the current costs for special education, including the cost of pre-K services for students with disabilities who have already been identified, to think about the current funding structure. So right now we have a single weight system, and to think about the implications of other parts of our current system, which include the high rate of including kids in separate schools and separate programs, and the cost of transportation. So those are sort of all the factors that are going to go on the one side of the input. And then we're asking for the study to make recommendations around the feasibility of having a multi-weight system, where those multi-weights might be set based on disability category or level of services and supports that are needed, the possible feasibility of using minimum school funding with respect to special ed funding, which right now it is not. And importantly, one really important piece of the funding study is that it is keyed to the idea that students are going to, what funding is needed in order for students to achieve grade level standards. So really I know people across the state are really looking forward to the results of this important work.
Yes. So I'll move on to the next study. So our next study was to seek a vendor to review both our individualized family service plan, which is for our students birth through about age 5, and our IEP processes and systems. So our IEP as you know, is the Individualized Education Program. So this RFP has already closed. We have already received bids. They are currently with our fiscal team, and then they will come to the programmatic team that is identified to review it. And just so you know, there are some individuals from the local education agencies who both have experience with these systems, but also have experience with systems that are not our Maryland Online IEP system, so that we can really get the correct type of feedback. So the project goals are evaluating the system, identifying and ensuring compliance with every component of the system, really feeding into the user experience to ensure that it's manageable, it's doable, it's workable. Because one of the things we do here is that the current system is clunky and may lose data if you don't save it frequently enough, those kinds of things. We also want to make sure that there's a feedback mechanism so folks can let us know what needs to be fixed, what needs to be addressed, how to consistently make things better. We want to ensure system accessibility. And so one of the things we really want our vendor to look at is there the availability or the possibility of families having a portal so that they could access their own students' IEP, whether it be for a meeting that they're about to have, or whether it just be to review it or to, share it with an advocate, a friend, whomever, so that they can access this document whenever they feel necessary. We're also looking for increased efficiencies and increased effectiveness. You'll also know, or it's also important to know, that currently our IFSP and our IEP systems are two completely different systems. So if and when a student moves from our infants and toddlers and early childhood programs into the kindergarten program, they need to begin an entirely new process. So our schools are really inundated with that work as a student moves into kindergarten. We want our system to be able to provide the comparative analysis for not only us, but so that our local education agencies can really manage their own data and really provide some analysis within their systems on how their students are doing. And then we want the vendor to make recommendations for system improvements. Now we'll talk a little bit.
Hey, Carmen, hold on a second. You want to ask
Yep.
a question, Joe? Go ahead.
Yeah, I just had a question, and first off, thank you so much for undertaking this massive project. And, I think a lot of these changes have been, much needed and identified, and a struggle for the community for a long time. And the fact that this is even being entertained, I think is fantastic. I'm wondering, I know so little about this, but in other states and other jurisdictions, are most of these solutions are hand grown and hand built, or is there the equivalent of like a student management system that goes through and does a lot, that's an IEP tool that does much of what we want? And do we have examples of like other states or localities where they have systems that you've looked at and you're like, gosh, this is such an upgrade to what we have, and if we had this, it has many of these features? Is this more of a potted solution, or does this have to be built by developers?
It really varies. So we do see that across the country, there are some very good systems that are available, I guess, on the open market that we would have to modify, perhaps to meet our needs. We're one of very few states that are required a birth mandate state. There are things that we do because of COMAR that might be above and above the federal requirement that we would want to make sure works, just the way our systems move. But there are packaged systems that we perhaps could invest in and modify. This was a self-creation, right? We have a few LEAs, we have 5 currently who are not on the Maryland online IEP system. Every system is on the online IFSP system though. And so we know that there are some efficiencies that LEAs have if they're using a student data system that we would want to make sure is in our system. So for instance, one of the systems talks about how their system contains all student information. So not only students who have individualized education programs, right? And so they're able to really track a student. They're able to, if a student requires an evaluation, right, the student's already in their system. And there's some real benefits, as you can imagine, to that. So that's why we really wanted an outside vendor to come in and look and make recommendations on how to best meet the needs of not only our educators, but our kids and our families.
Thank you
And
so much.
I think maybe just one more piece, Joe, is that I don't think that there's an obvious solution. I guess
Sure.
that's the, right. Like,
Right.
it's not like,
Right.
oh, 48
Yeah,
states
like-
are using whatever tool. Like,
Sure, sure.
and it is going to be a big lift
Yeah.
if the solution is proposed and accepted that we should shift to something new.
Sure.
But no time like the present, if that's
Yeah.
what it's going to take.
Yeah,
right?
and we've had the same system for 20 years.
Yeah.
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 You know,
Yeah.
Sure.
so the next thing we just wanted to bring up was related to our pre-K system work. So there's a pre-K systems analysis work group that was created to fulfill the legislative mandate and include providers from centers, family childcare, and Head Start, as well as other interest holders in what we call the early childhood ecosystem. So that includes advocacy organizations, the Maryland Department of Health, pre-service training programs for staff, the Division of Early Childhood in the Maryland State Department of Education, and our superintendent. We're very purposeful in including a local education preschool special education coordinator and private providers who offer inclusive settings for children with disabilities into this work group. So you'll see that MSD leadership is overseeing the work of the work group. They have monthly meetings. They're considering the mixed delivery publicly funded pre-K system, including all these components. And they have an interim report that is due by June 1st, 2026, and a final report by December of 2027.
And I'll just add that 2 things here. One is some of these meetings are open to the public, and actually even for the public to participate, people who are interested and have things that they want to share. So that opportunity exists, and the website is there to follow when the meetings are happening. But I also just wanted to add, one of the reasons why we included it here is because within the law that was passed last year, HB 1475, included the scope of what this work group was supposed to cover. And one piece of it is to how best to use publicly funded pre-K to provide quality early childhood education for students with and without disabilities together in the same classrooms, including methods to combine federal, state, and local funding sources to improve teacher and staff training and recruitment to address the needs of all students, including students with and without disabilities, and to foster collaboration between private and public pre-K providers in delivering specialized transportation and services for students with disabilities. So this is, all of those items came directly out of the work group and our recommendation around pre-K.
Now, Liz, I'm going to let you take this next one since you just had a presentation and an overview of the
Sure.
work for secondary transition.
Sure. So there's some really exciting work that's going on around secondary transition. So secondary transition is that process that happens in Maryland starting when you're 14, in planning for exiting school, either with a diploma or with a certificate. And one thing that we have in Maryland is this thing called the State Agencies Transition Collaborative. And that's existed for some number of years, and they have an MOU, and it brings together a whole bunch of different agencies that work on different aspects of facilitating particularly secondary transition for students with disabilities. And they have developed a subcommittee that is developing a proposal for a diploma pathway for students with the most significant cognitive disabilities. So right now in Maryland, you either get a diploma or you get a certificate of completion. And a certificate of completion doesn't really mean a whole lot. And in other states, that is not, there are lots of options. So in some states, they have something called an alternate diploma. Some places have something they sort of call like an IEP diploma. Those things are not great. The proposal here Dr. Wright, I think, asked a group of folks to get together and do some research around different states and what they've done, and to come up with a proposal for an alternate pathway to a diploma. And so that work is ongoing, and they are, I think they have about a year to do that work. So that's pretty exciting for families that have kids with more significant disabilities.
Yeah, and I will say that I think what I hear, particularly from our staff, is how valuable it is to have an interagency collaborative really impacting this work. So they're working very, very closely, particularly with the Maryland Department of Disabilities, on a lot of this work. And one of our staff is co-chairing with one of theirs. And it's just the movement over the last year has been remarkable. So next we'll move into our career connected learning system. So this is really an integrated approach to help our students identify, develop, and practice the skills they need, right, to be successful after graduation, really supporting them to make informed decisions, and really helping them to begin, hopefully, as early as 14, even before that, if they can, if they wish to, really talking with students and their families about what is appropriate for the student, what pathways can they seek, also blending course options and using career coaches to really support our students in the field. So we anticipate that what we're calling the CCL will be fully in place by the 2027-28 school year, where students will be able to earn by participating in apprenticeships, internships, capstone courses, and projects, or by working in a school-based enterprise. We're currently working with the Division of College and Career Pathways, where they're collaborating with our local education agency stakeholders and across Maryland State Department of Education. That includes the Division of Student Services and federal programs, special education with our secondary transition team. And they're also leading a subcommittee where they're obtaining other input. These flexible pathways will create more opportunities and options for our students to become really college and career and community ready, making sure Pillar 3 of the blueprint includes everyone, all of our students. So flexible student-centered pathways will allow our students to earn credits in ways that align with their interests, their career goals, their learning preferences, things like dual enrollment, online courses, in-person centered and connected learning experiences, and career tech ed. So blending courses will allow our students to combine academic classes with career-focused classes. And we find that that flexibility really allows our students to earn credits that they'll need to graduate, while at the same time really earning some real-world skills. So finally, we'll talk a little bit about the career coaches, where we're starting this in elementary and middle school years, carefully planning and encouraging our kids to really explore their interests, building their attendance and their academic skills to be successful in their future careers, with 6-year plans developed in the 8th grade that will be revisited annually with collaboration of supportive adults. So whether that be career coaches, school counselors, trusted educators, they'll all be involved in the process.
I'll just say that I will that the secondary transition team and the work that they're doing with college and career pathways at MSDE, I think is really a model for the kind of cross-divisional collaboration that we need to see. They have broken out of the silos, and they are working together really beautifully. And you know, this was an area of a lot of intense interest and concern amongst work group members, that Pillar 3, as we were hearing about things that were rolling out, you know, were folks really thinking about all kids? And when I started hearing the way that folks were talking about career-connected learning, I thought, oh, this is it. This is people really thinking about all kids. And what does it take to have an apprenticeship that works for a kid with an intellectual disability, right? How do we make sure that CTE, not just CRD, the Career Resource Development, which was where many kids with disabilities ended up kind of getting dumped into that CTE program, but across, you know, whatever that child's actual interest is. So I think it's, you know, it's exciting work, and I think it's exactly the kind of thing that we were hoping was going to come out of the work group.
Yeah, and so I've been here for 11 years, and I think this is something I've been hearing about, but I don't know that anyone knew how to really cross the divisions within the department, but also cross agencies to make this happen. And it's the excitement around this endeavor, around this process is wonderful. So finally, we're going to give you a little bit of an update on our alternate framework eligibility. So we have developed a self-assessment tool for our local education agencies to self-evaluate their own practices. We've completed audits for disproportionality and early identification for the alternate framework, with findings that indicated that there is a lack of evidence in the documentation that the individuals identified to participate in the ALT framework, a lack of evidence of cognitive disability for pre-K students eligible under a developmental delay, and students eligible under a category of multiple disabilities. Additionally, they also discovered missing parent signatures on the Appendix A, which is the self-evaluation tool to ensure understanding and consent. And I'll tell you that our team they initially reviewed well over 400 IEPs and documentation for the ALT framework, and that led them to be able to review close to 250 individuals' records. So this was, a rather broad review of records, and that's why they were, I believe, able to find these findings and issue corrective actions and provide real support and technical assistance to these LEAs and the staff completing this work to make sure that in the future it is done well. We have a draft waiver extension request currently being posted on our website for public comment that will close on November 3rd. And then we are required to submit justifications and assurances by November 15th. So this is regardless of the federal circumstances. These are requirements, so we will submit them. And the only, I guess, glitch is we don't know how quickly they'll be reviewed, so we don't know how quickly we'll hear back. But we anticipate exceeding the 1% again, which is why we are submitting the waiver extension request. So it requires that we analyze our disproportionality and early identification, that we identify and provide training, additional audits, and that we examine the potential alternate pathways to a diploma for students traditionally served on the Maryland Certificate Program. All members of the public have been invited to comment on the draft waiver extension, but please make sure, if you know folks who would wish to do so, that happens by November 3rd. We know that's quick from today. And all the LEAs who are anticipating being over the 1% are required to submit justifications or where they see the drivers for them being over the 1%. And ultimately, they need to address and ensure that they are under the 1% threshold as a federal requirement.
I see that we have used up a lot of your time, and I think we're going to stop there. The last thing I'm just going to say is around,
you can keep going. We're good.
Well, we had just been specifically asked about Pillar 2, and so I'm going to kind of speak to that. I don't have a slide about it.
Yeah.
Priority 3, which is when we looked at those priorities, was about the enhancing the supply and retention of teachers and developing teacher capacity. And so that's, I think, the area where we've got a lot of overlap with Pillar 2. And there are sort of 3 recommendations that are part of that priority. So recommendation 7, which is about the knowledge, skills, and expertise that all educators need to have to effectively educate all kids. Recommendation 8, which is about recruitment and retention and having a plan for building up the stable, diverse workforce, including not just special educators, but also related service providers, paraprofessionals, et cetera. And then recommendation 9, which is about staffing and service delivery. So, that's a lot. There's a lot there. And I think it's going to get attacked from a number of different angles. Mm-hmm. So, there is pipeline work that has been going on around the state. There are grow your own programs, and we have a couple of examples of ones that are particularly going after and trying to develop talent to become special educators, paraprofessionals to become special educators. There's a registered teacher apprenticeship program that's in the works. So there's that kind of pipeline work. There is some additional work, I think, that needs to be done around COMAR and thinking about licensure and educator preparation programs, just taking a look at, because they've just did a big revision of those regulations a couple of years ago, but to take a look again with sort of the fresh lens from the special education work group. We made a list together as a group of what knowledge, skills, and expertise we think general educators need to have, special educators need to have, and all educators need to have. And so I'd love to have that work, move forward. And then lastly, I mentioned earlier that retention was an area of particular interest. And I see a lot of overlap and sort of a big bucket of work that's around scheduling, staffing models, and service delivery. And actually, all of it has to do with retention, right? All of it has to do with building school communities that really work for kids and for adults. I often think of Justin Robinson's thing that I've heard him say many times, that student learning conditions are teacher working conditions and vice versa, right? That is very top of mind for me. So I just think there's a lot that can be done to present models that work. How do you, with an elementary school of 400 kids, what is the schedule, or what are the three options for schedules that center the needs of students with disabilities, work for all kids? How do you staff that school appropriately? And can you provide two different models for staffing based on, whether it's a school with high concentration of poverty or not, right? I just think we can provide some options for folks as a baseline, as a foundation, and I think and we can think about how that grows over time. So I'm excited about some of that work, and I think I think it's a very cross-divisional thing, because I think we're seeing some models of schedules that have come out of the literacy work. I think that there's folks in special ed that are thinking about those things. I think there's some folks that are thinking about attendance and behavior, and they're thinking about staffing models. So I think there's a lot of overlap, and I think it's getting a lot of those people together to think about those things together.
Yeah, and just to mention two specific grow your own initiatives. We do have through our Elevates grant program, we were able to award Mount St. Mary's and Towson University grants. So both institutions are currently enrolling and recruiting paraprofessionals, so the supports in the classroom, who are interested in pursuing teacher licensure, right? So how can they expand their careers? So they're obtaining either a bachelor's or a master's degree. And these two schools are particularly focused on Baltimore, Anne Arundel, Frederick, and Washington counties. So at Mount St. Mary's, program implementation is going really well. They've had continued recruitment. At present, they have 8 participants in the initial phase, 6 fully enrolled, and 7 completing internships. All participants are on track to graduate and earn teacher licensure for fall 26, fall 27, and fall 28. And at Towson, they have candidates who have successfully completed their coursework, and current data indicating that there is steady academic growth with no signs of regression. The first cohort is projected to graduate in 2027, with the second cohort in 2028. So while they're small groups, they are really focused in certain areas of their state where we see a really significant need for special education teachers.
And now we would love to hear your questions.
Well, first, as always, you set the bar so high that I'm always intrigued and listening. Because it does show the cross collaboration and focusing on students with disabilities. If anyone has questions, go ahead and raise your hand. I got my list. I want to make sure I don't take up a lot of space if someone else has a question. So I love the conversation you are having about the standards-based training and making sure that that went from the state down going into LEAs. The one thing I do have a question about, within that training, was there a conversation or part of the training that was around family capacity building sessions being held at the same time, and how that standard-based training may have had that embedded in engaging families in that language and understanding what it means to be reaching those goals that are narrowing the gap goals, and that being new language. And if so, how is it done? Is that something, if it's not done, is that the next phase of it? Because I do know, as someone who was a former administrator and worked with the birth through second graders and understand about the family service plans and going to IEPs, but then also working in environments that have multiple cultures, their interactions with special education services and what they culturally feel about students with disabilities, I think is something that we cannot take for granted, not to train special educators and related service providers on, to make sure that they continue to speak with asset-based based language. So if you could just talk about the family engagement piece to it, parent caregivers, and if that is a part of that standard training.
I'm going to let Carmen talk about whether, I don't know about whether it's part of the standard training, but I will say a couple things. One is one of the recommendations that came out of the work group, and it is not yet in the works as far as I understand, is around helping LEAs understand how to build relationships with community-based organizations that can kind of do some of that intersecting kind of cultural broker kind of work. And I think when you guys have the community well, or some of the folks around multilingual learners, they may be able to speak to some of that as well. But I also think that how we go about training getting families to understand that they're the experts in their own children, right? That's like a really key piece, and how we can encourage families to understand that is not something I think that makes sense to go directly from LEAs or from the state to families. I think what we need to do is teach teachers and school-based teams how to help families understand that, right? Because we can't rest. I mean, I am of the mind that we don't want to rest sort of progress for students with disabilities on training families. Like it's not the right. We don't rest sort of progress in the medical world on like training people to be their own advocates, right? We want our doctors and our nurses and our medical systems to help patients understand how to advocate for themselves. So I think that's the same kind of model that we need here. But definitely agree that teams need support to know, and there is a whole body of literature and knowledge and understanding about how to support families in understanding that they are the experts of their own children. So I certainly hope that will be part of what we are training teams to do.
Yeah, and again, as Liz said, I don't know that it's part of this initial training, but there are recommendations on really creating authentic family relationships. So we're actually starting on the side where we recently had families come and provide like a panel discussion with our special ed directors. So we have an entire family support section here within special education. They provide direct support to the family support centers in each local education agency. And we also give them some funding for that. So what our team has done is they've really developed systems where they can provide some of that training to those family support offices, and which are almost completely made up of families of children with disabilities, right? But then also really beginning to share that out to some of our special education citizens advisory committees. So every LEA is required to have a citizens advisory committee that advises specifically special education. So we are bringing them into our state advisory committee, sharing as much information as we can with them, and then helping them to move that information forward into their communities.
2 more really quick things. One is specifically on narrowing the gap, because it is new language. One of the things we're working on, and we're going to be working on, is taking sort of some of the great guidance that comes out of the state, but that is very jargony or very long, and really creating one-pagers, infographics, like really simple things that both will be useful, I think, for classroom teachers and paraprofessionals and educators, but also for families, so that and kind of figuring out how to get those things out there. And also, I just want to sort of shout out the work of Parents Place of Maryland, that it can be a real partner in helping communicate with families, because that's where their expertise is. And while we still have federally funded parent training and information centers like Parents Place, we need to rely on them for that expertise.
Shalita?
I just want to say that I'm really excited about the work that you all are doing. As a speech language pathologist, I'm excited to hear you're about to improve processes when it comes to like the IEP. And there, like you said, there isn't a system that a totality of a system where everybody, all the student data is in one location. And so if they move from another LEA, it's very, very hard to get that information. And, sometimes it could be weeks. And so that is impeding on, the service time that you're providing with that student. So I'm excited to see what happens from the report that is established. And I also have like a long list, but I'm just going to keep it short. But I just want to make a comment about the providing the technical assistance when it comes to like report writing. I wanted to ask, what does the technical assistance really, I guess the word I'm looking for, like, what does the technical assistance really provide? Because a lot of times, from a district level or from a state level, you're just looking at what is being written. And so, like, is there any additional training when it comes to like really painting the picture of what the student is actually doing? Like, does that include the technical assistance? I mean, I know that goes back to graduate school, but it's like when you're in the field and you just kind of like write in the notes, sometimes you're not fully grasping what the child could do. So I just wonder, like, is that one of the supports that you all are given to, especially teachers, related service providers, for that, like painting the picture so that you can really monitor their progress?
Yeah, so that's an interesting question because that's not something we used to do. And this administration, particularly Dr. Wright, has really has pushed us to think differently, right? So what we're doing is we're really trying to push in that technical support to the classroom, to classroom teachers, to in some cases, right, if we're getting information that there's a teacher with students whose behavior she can't manage, right? We may be going into that classroom. We may be providing technical support to that teacher on how to perhaps better manage those behaviors. But in other cases, we have gone in and provided some, professional learning to, let's say, 500 teachers on writing appropriate IEP goals, right? Like, so we're doing a lot more of that. And I think we can say that we've probably provided really teacher training, which I don't think we did before in special ed. And we've probably provided that to a couple of thousand people in the last year, which isn't everyone, but it's right. It's a drop in the bucket. So we can keep going because we are seeing the impact of that professional learning for folks. And we're providing coaching or teaching people to be coaches whenever possible.
I was going to hit on what you said about the career coaches as well. And just wondering, like, are you using a particular criteria? Because I know like with standardized assessments, when you're doing the transition, the choices for jobs are very limited. And a lot of times they talk about like stuff that's extremely dated, right? But a student who has a device, very, very smart when it comes to electronics. Because if they can get on YouTube, there's so many steps that's involved with even typing out the Y or recognizing the icon of YouTube. But we don't have any, correct me if I'm wrong, but we don't have any jobs that we could tell students who may have a disability but is grading technology. That is another avenue you can go besides shredding paper or washing windows or, cleaning up the tables. It's like, no, I want to
do you
communicate.
see me? I'm itching. I can't wait to talk
Go
about
ahead, go ahead, go ahead, go ahead.
I think what you're referring to is this really pervasive and kind of insidious truism, right? That when we think of students with disabilities, we think of people with disabilities in the workforce, we think of the 4 Fs: food, filth, flowers, and filing, right? Those are the jobs. And we've got to break out of that. We are an employment first state, so we hold to the principle that people should be employed if they can be, and that everyone should have the dignity of work. And I would push further than that to say everyone shouldn't just have the dignity of work, should they choose it, but they also should have the dignity of career, should they want it, right? Not just a job, but a career. But to do that meaningfully, right? That's a lot. I mean, that's not something that we're going to snap our fingers and we're going to create. It's going to take a long time. But there's a few things that we are beginning to do. So one thing that got added actually to the AIB's comprehensive implementation plan around the preparation of career coaches was to make sure that there's some amount of training that those folks get that has to do with racial bias. And what the thing that was added this year was to add understanding of disability. So to try to sort of, so that, they're confronting, maybe a career coach has never interacted with a young student that uses a device to communicate, right? They're going to need a little bit of support to figure out how to do that. So that's number one. And then the other piece was, we didn't talk about this when we were talking about the certificate, but work that had been done over several years that has been rolled out very recently is around endorsements. So that has to do with students who are on certificate track, right? Who are going to graduate with the certificate. And they are these very thoughtful, meaningful lists around employment skills, post-secondary education skills, and community living skills, where IEP teams can think about what skills students actually have and identify them. And then that becomes so that they can graduate with an endorsement on top of their certificate. And it can be used as a tool to understand what skills does this student have that can translate to the world of work. So I think it's exciting work.
So you weren't a plant, but that was the next place I was going because I got very excited, Shalita, when they talked about career connected learning system. Because as the supervisor for community schools this year, I have the blessed opportunity to see Carl Sandburg School, which is my first through fifth graders, and then my Rock Terrace School that is 11 to 21, and going to see like that transitional growth and then just how kids get to that senior year and then what are we talking about for their transition. So I kind of got excited, and then when you started talking about it, I was like, well, why couldn't this be maybe an answer for the pipeline? We are making assumptions that these students couldn't be paras or supports, and I had never heard the F's that you just said. That was my first time. And so that really was me just thinking like there are some that could probably use their communication boards and be a para for a younger student to teach them how to use their communication board.
Love that.
And then, because there are so many things that they learn to add and do that just framing that into asset-based learning and discussion. And so my last question, because I see Dr. Grant, is in the development of the system for IEPs, is it in it to have maybe an opportunity to have cross LEA transference of the IEP electronically, but then also somewhat have it set up to where when it is transferred in a way that already speaks to the assets. And I think it kind of goes back to what you were saying, Shalita, like there are goals that are written, but when I watch the student in their learning environment, can I flip what I'm seeing into asset statements and not just what they were not able to do, but the assets of what they were able to do? I'm just excited about that. So if you want to pilot, I'm just saying, Montgomery County.
Well, competency-based IEP development is a really exciting area, and And I do on the side, I do some presentations on parents and teaching parents to be the ones who bring that sort of
Mhm.
competency statement. So, and sort of vision statements about their kids to IEP meetings, and happy to do those wherever around the state. So,
Appreciate it.
In relationship to the study, it's all on the table,
Great.
right? So
Mhm. Love it. Dr. Grant?
Thank you so much. So first, I want to say I believe the work group has really set the bar high in some of the recommendations, in which it should be set high because we're talking about our students that we're serving, and we want to make sure that we provide them the tools they need for success. I'm so glad you spoke about, you identified them as numbers 7, 8, and 9, and that was about the teacher. Processes when collaborative planning and the teacher learning opportunities. And I'm sitting here and I'm listening and I'm saying to myself, those things have to happen first in order for us to implement anything effectively. Because the teachers that we had of yesteryear are not the teachers of 2025. They're not coming with degrees in education or special education, and we have a number of vacancies. So, in order to make any of these things sustainable or to happen or to see a long range effectiveness, we got to build teacher capacity. I've been speaking to my particular district around all teachers being trained in SDI, specially designed instruction. Every teacher. Because why? They're teaching the children. Resource teachers don't spend as much time with scholars as the homeroom teacher does. So I love the direction we're going in. I just question sometimes the sustainability and how the implementation will look if we don't start with building teacher practice and everyone understands what this should look like to benefit students. So I guess I had a question, but really a comment, and it'll be nice if there was some district initiatives, excuse me, not district, state initiatives around building teacher capacity around SDI, and one, making sure teachers have enough planning time so they can make sure they're implementing learning opportunities that meet the needs of scholars, because otherwise we're going to be saying all these wonderful things, but on the ground in the schoolhouse, they're not being implemented.
Dr. Grant, I 100% agree with you, and I think that it is I think it's important though that we don't think about it as a chicken and egg kind of situation, because if we wait for teachers to be ready, we're never going to get there, and so we've got to kind of build it while we're flying it. And it's the reason why I sort of leaned into this idea around models for scheduling, staffing, and teacher collaboration, because I think all of those things can go together. There are ways, I think, that we could come up with to staff in such a way that the couple few, however many experienced mentor teachers that you have in your building can be part of the training and support for those new teachers that you're training up. If we have the right schedule to make that possible, right? And that, I'm not saying it's easy, but I think that's the direction we have to go in, and to make sure that once you've spent and invested in training folks for a couple of years, that they're not just going to leave, and then you've got to start over again. So it's how do we bring people in the door? How do we start to train them up? And then how do we hold on to them so that they can continue to build their skills over time? And I think the only way to do that effectively is to start to create the schools that we want to have, and while we're building teacher capacity. But I also think that really there is this big piece of making sure that the guidance that's coming out and the professional learning that's coming out is very accessible and very immediately actionable, that it's not just kind of pie in the sky, but it's really like, how can I take this tomorrow into my classroom and make it real for kids, even if it's one thing that I can do differently. I think we've got to figure out how to make
So I
that.
have one last
I
question. It's
wanted to,
very quick.
I'm sorry. Can
Oh,
I
go
just
ahead, Dr. Grant.
That's okay. I just wanted to say that I agree that you can't wait for a student to learn their alphabets before you start to teach them sight words, right?
Mhm.
So you do have to move the process along to make sure that we're still meeting the needs. I'm
Mhm.
not saying that you wait for teacher development. I'm
Yeah,
saying that has to come as a primary focus.
absolutely.
And if it's not, then all of the other ideas that are being generated, who's implementing them?
Hmm.
If the people in the classrooms don't have true understanding around best practices, and because we're hiring people from various backgrounds now, not education. And so I just want, I guess I'm pushed because I'm in the schoolhouse doing the
Mhm.
recruitment and I see the applications that are coming in. And I know the work that I have to do to build their capacity so they can adequately teach these scholars. And I agree, once I put all that work into building capacity, the last thing I want you to do is leave me. So
Yeah.
you do have culture, you be in
Oh, the last part went out, Dr. Grant.
the schoolhouse and it's a
She's going in and out.
Hmm.
So Dr. Grant, you keep going in and out. So I'm going to ask my question really quick, and then we'll get ready to do our close. So the one thing that I don't think came up yet was, do we have post-secondary options for students with disabilities to have the experience of college? And I only say that because I literally follow two different people on Instagram, and they're in their last year. One is at Alabama,
Hmm.
and one is, I think, at Clemson. And I might be naive, but I don't know if we have that in the state of Maryland.
We
But
do.
we do. And so can you just speak to like who that is? Because
Yep.
that I think should be something that we end, not that this whole night has not been positive, but that would be a great thing just to make sure that that gets out.
Sure. At the University of Maryland at the flagship campus in College Park, there's a program called Terps Exceed, EXCEED. And it is small, but it is growing. It got state funding for the first time last year. And they are doing a wonderful job. They actually, down in Annapolis last year, while they were advocating for their funding, they brought groups of students, um, student mentors and students with intellectual and developmental disabilities to come and testify about what the program has meant for them. It is allowing families to dream big about
Mm-hmm.
sending their kids to college. My daughter has two older siblings, one who is now in law school and one who is in college now, and it is her expectation that she is going to go to college, right? I
Mm-hmm.
was having a conversation just recently with somebody who was talking about, why shouldn't we teach life skills to kids?
Mm-hmm.
Learn how to do laundry or cook for themselves. I said, guess when our kids are going to learn how to do all those things? In college. They're going to learn it just like the rest of us learn it in
Mm-hmm.
college. Um, let's let them have high school when it's high school time, right? Let's have
Yeah.
them really experience that fully and then learn how to do the things of adulthood in the same way that the rest of us learn it as young adults in college. So yes, the Terp Succeed program is very exciting, and get an opportunity to audit some classes, to
Mm-hmm.
learn alongside your peers. It has inclusive living, so you can live in a dorm,
Well,
and have all the experiences that our young people deserve.
great. And I believe your daughter has a wonderful name, if I'm correct.
She
You said her name
does.
was
She
Hope.
does.
Just throwing that out there.
Yep.
And so once again, I want to thank you both for coming and giving us an update. We were highly impressed and engaged last year, and this 1 year update really just speaks to the um, high level of interaction and engagement across your work group to have a plan, know the goal and make those steps, no matter how tough they might be, to set that bar very high. And so we appreciate you coming to share that with the entire group tonight. So I thank you for your time this evening.
Thank you so
And
much.
then I want to make sure that I do highlight that the Pillar 4 committee will actually not meet in November or December. Our next meeting will be January 27th at 4 o'clock. It is packed, and we would love for people to make sure to join us. In that meeting, we will be discussing the Neighborhood Indicators of Poverty research findings. And also, we do have currently right now the multilingual learner work group best practices. But if anything, if it turns out like this, we might have to adjust some of that schedule. But we really want to make sure that people join us in the new year in 2026. And during this time from Pillar 4, just know that we wish everyone the best. We hope that if you are needing resources, you are able to find those resources during this time. And at this time, I will adjourn our meeting. Oh, sorry, Ellie, go right ahead.
One thing, Hope, we may want to revisit having a meeting in November, regarding the neighborhood indicators of poverty, because there is a special AIB meeting on the 1st of December to potentially make a recommendation on the findings from that report. So just something to think about. The other thing, I just wanted, I didn't ask any questions because I feel like I know where to find Liz if I need her, but I just wanted to say that the work was, the work is very impressive, and I want to thank you again for being here and sharing it with us today.
Thanks, Ellie.
Thanks, Ellie. And so at this time, we will wish everyone well. Thank you all for coming, and have a great evening.
Thanks, everyone.
Because
Yes, we can end.
Sites. I was like, oh, my birth type is.
Okay, we can ask. All right, hold on.
My masters are such a bother. I understand perfectly. I know.
Are you asking me? Or are you talking to somebody? Oh,
Hold on. Yeah. I'm trying
okay.
to end